Okay, today we're going to talk about asthma. This is very prevalent. 7 million children in the United States alone have asthma. It's caused by an inflammation inside the airway. Something is blocking. It's an inflammation from toxicity, infection, but mostly allergy that creates this blockage, this inability to get air out. Now, we have to be able to rule out whether it's emphysema, which is usually associated with older age, infectious bronchitis, whether this is something that's come on from just a normal cold or a flu, or whether it is asthma, because asthma mostly is allergic type asthma. Today's video is what to do in an emergency situation when there's an inability to breathe and it looks like asthma. What to do?
Grass pollen season brings the chance of thunderstorm asthma. For people with asthma or hay fever, especially those who experience wheezing or coughing with their hay fever, it can be sudden, serious, and even life-threatening. It's important for everyone in the community to know the 4 steps of asthma first aid. The most common symptoms of asthma are wheezing, shortness of breath, chest tightness, and coughing. If you think someone is having an asthma attack, Step 1. Sit them upright. Step 2. Shake the blue or grey reliever puffer and give them 4 separate breaths, using a spacer if available. Step 3. Wait 4 minutes and give 4 more puffs if the person cannot breathe normally. Step 4. Call an ambulance if they still cannot breathe normally and keep giving reliever puffs as before until the ambulance arrives. Protect yourself this pollen season.
Now, using the inhaler is important, but the reason that you have asthma is not because you're inhaler deficient. The reason that you have asthma is because there's some type of inflammation inside the lungs from dust, pollen, mold, animal dander, something that is creating an imbalance and restricting the airflow out of the lungs. Now, if we look at the sympathetic nerves and the parasympathetic nerves, we will see that the parasympathetic nerves constrict the lungs and reduce the flow. We have to then first, very, very important, remove the person from the allergy triggers. Use filtered air, get filtered air products, get them away from what you think might be the problem, whether it's food, whatever it is, get them away from the allergen. Good air. Next, have the patient sit or lay down. This will reduce the oxygen intake load, but have them imagine vigorous exercise. This will stimulate the sympathetic nerves and open up the bronchioles. So allow them to then imagine vigorous exercise that will stimulate the sympathetic nerves. In an emergency situation, 1, 2, 3, or even 4 cups of strong coffee can stop asthma. Next, very, very important. As they are thinking about the vigorous exercise, imagine that there's a mouth at the top of the bronchial tree. You see where the mouth is. Imagine that there's a mouth there, and that they are breathing in and out of that mouth directly. This will relax the bronchial tree and help to get air started. Then tell the patient to hug themselves and squeeze the air out of their lungs. 3 or 4 breaths out before breaths taken in. Squeeze the air. Hug yourself. Love yourself. There's always an emotional content to asthma. They don't love themselves. They separate themselves. Now, hug yourself. I love myself. Use the affirmation. Imagine the mouth on the bronchial tree. Imagine this. Another affirmation. I'm ready to receive love. Feel love. Imagine yourself participating in the exercise with other people. Imagine this in your mind. Use the breathing in and out and imagine that there's a mouth on the bronchial tree and hug yourself, love yourself, hug and push the air out of the lungs. This will then create a release and help you to get out of the asthma emergency. Now here we have one of the bronchioles inside the lungs, and we can see air coming in and out. There's a soft tissue of muscle inside. Inside there, different dust particles can trigger allergy attacks, toxicity can do this, other different things can create a disturbance where a swelling inside the tubule will restrict the air coming out of the lungs. Air can't come in, but air can't get out. This is most important. That's what's happening in the asthma state. And sometimes these muscles can be twisted. These are muscles stimulated by the parasympathetic system. So we need the sympathetic system to work on it. So we're going to have to do things to stimulate our sympathetic nerves, okay, to help get us out of this allergy attack. Recognizing that this asthma now is a restriction of flow from the inflammation, and inflammation from toxicity, from infection, but most of the time asthma is allergic type. Now, as we can start to relax, we can start to reduce the inflammation, okay? But we have to use the sympathetic nerves and create inside the mind the stressful situation of exercise. This will allow vasodilation. We have to push the air out, and then we can cure the asthma. Now, remember this trick, and here I'm going to teach you another trick.
In the next few slides, we will review the technique to stop an asthma crisis without any medication, thanks to the Jesre method. The problem area is 90% of the time situated under the left armpit and very rarely under the right armpit. Place your right hand on the left thorax so that your index finger is positioned under the left armpit. Probe with your finger to find the space between ribs. Gently massage the space between the ribs while probing for a small lump. You should find a point or several that will be very painful to your finger's pressure. Something like a small ball of grease that you can roll under your finger. Once you have located it, gently apply pressure, which will make you grimace with pain. Now, massage mildly, while pressing just to the limit of the pain you can endure. At this time, you should inhale deeply. You will notice that breathing becomes easier. If massaging and pressing the most painful point is not sufficient to make you feel 100% better, look for another lump nearby the one you are working on, or under the right armpit. This should take care completely of the crisis. Warning: this technique is of no use in breathing difficulty, which is not asthma but the spasm of the throat. This condition is sometimes called false asthma. For more information about the Jesre method and how to cure asthma without medication, please visit asthmareality.com and find us on YouTube and Facebook.
You see, it's the parasympathetic system that will constrict the flow of oxygen into the lungs by restricting the bronchioles, okay? So now we will need to switch and get the sympathetic nerves working, so we're going to need to take the calcium and the phosphorus. Do not take the potassium during this asthma bout. We're going to need to be aware of this and stimulate the sympathetic nerves. We can also recognize there are acupressure points that can be used to help to get you out of the asthma attack. Here's some of the real key acupressure points. Simple little pressure. These acupressure points can really help to get you out of that asthma attack. Very crucial. Try to learn about these. Use them. You'll be able to replace the inhaler if you can do this correctly. Best vitamins for asthma are calcium, magnesium, pantothenic acid, B6, vitamin D, shown experimentally to help, and of course always vitamin C. Certain people have learned to deal with their asthma by running through it, by actually exercising. Certain of the best athletes in the world has asthma as a child, and then they could learn to get out of it. Because asthma has an emotional component. Now, there are many different home remedies for asthma to be able to deal with. These are some of the best ones. And I wanted you to realize that there's certain really powerful herbal treatments, okay? Mustard oil, camphor, menthol, eucalyptus, spread over the chest externally. This is not an internal. Curcumin is fantastic for almost all things and very, very good at reducing the inflammation of asthma. Many other different home remedies that we have developed and tested, and I'm giving you some of the best ones here. Use these very wisely. If you have questions, send us comments, and we will help to respond to you. Recognizing that there are also different types of anti-asthma foods that you could use to help deal with the asthma situation.
Hi, and welcome to The Alternative. There is nothing more important than breathing well, and nothing more dangerous than constriction in your breath. Asthma affects millions around the globe, and while inhalers are important to control your asthma, there are also natural remedies that can provide long-term additional help. First, make a mixture of powdered dried ginger root and black pepper in equal amounts. Mix 1/2 teaspoonful of this powder with an equal amount of honey and swallow twice a day with water. The honey will soothe the mucous membranes that have become inflamed through asthmatic coughing, and ginger contains components that have anti-inflammatory and analgesic properties beneficial for curing asthma. Now, it's important to note that this is a supplemental remedy for lessening your asthma in the long run and should in no way be a substitute for your inhaler, which you should still carry with you at all times. But this remedy should provide clear and substantial benefits so you can finally breathe peacefully again. Feel well, be well, live well. Namaste.
Hello and welcome to Style Craze. In this video, we're going to talk about asthma. Asthma causes difficulty in breathing, and if like me, if you suffer from asthma, you're always carrying an inhaler like this. In this video, we're going to talk about simple home remedies which will give you relief. In this home remedy, we need to add 2 to 3 cloves in a 1/4 cup of milk. Boil this and allow it to cool down. Once it is cool, drink this to get relief from asthma. In this home remedy, we take a little bit of mustard oil and add just a little bit of camphor to it. This mixture needs to be heated, and once it is comfortably warm, you need to massage it on your chest and upper back to get relief from asthma. In this home remedy for asthma, we take 1/2 cup of pomegranate juice, and we add 1/2 cup of ginger juice. To this we add about a tablespoon of honey. Have a tablespoon of this 2 to 3 times a day to get relief from asthma.
There is a time that you need to go to the medical doctor for the asthmatic chest problems. Take a look at these warning signs and learn them very distinctly. Now, we also want to use some electroceuticals, okay? We use electroceuticals that will help to open up the lungs. As you breathe and you start to use these electroceuticals, vibrations and suggestions that help to open up the lungs. You can get these electroceuticals by contacting us on the site and asking for asthma electroceuticals that will help open up the lungs. So I hope that I've trained you a little bit about emergency work and also treatment of asthma. Yes, one of our asthma electroceuticals has been playing throughout this entire tape. So if you want to learn more about what we do in natural medicine and using the electroceuticals, contact us.